Good morning. Thanks as always to Jay and Vicky for interpreting. Jay is looking especially dapper today. So is Vicky, by the way. But anyway, good to have you back, Jay. So it's been a busy week in Hamilton County with 320,008 people. It's just about 40% of our population either starting or completing vaccinations. So here are the numbers. In Hamilton County alone, 78,409 positive cases of COVID-19 have been detected. The delta between this week and last week is 689. 2,964 hospitalizations total. Delta is 76. And 1,170 deaths total. That's what we've seen in Hamilton County. The addition since last week. So today the message is that in Hamilton County, it has never been easier to get a COVID-19 vaccine. If you've been sitting on the sideline because you didn't want to wait in a line, you saw your friends or family struggling to get an appointment, you heard about the scarcity of the vaccine, it's time to get your vaccine. Appointments are available, and in many cases, you don't even have to make an appointment. Hamilton County Public Health vaccine sites, including the site at the Board of Elections in Norwood, no longer require appointment. You can walk right up. Low to no wait time for these shots, and the City of Cincinnati Health Department, some of their vaccine sites no longer require appointments either. I'll give you an example of just this weekend. We've got walk-in vaccine clinics available both Saturday and Sunday out the Health Expo in Washington Park, Children's Hospital, Health Source locations, Sterling Rapid Response in the Tri-County Mall, Healthcare Connection, Tri-Health, Christ Hospital, and the Urban League. You get the idea. Vaccines are available. As always, you can go to testandprotectcincy.com and get a listing of all those sites. Make sure you're going to the right place at the right time, or simply call 211 to make sure that you get in line for the vaccine, or at least you know where you're going at the right time. On weekdays, walk-in appointments are available at the Hamilton County Board of Elections and the Sterling Rapid Response at the Tri-County Mall. Hamilton County Board of Elections times for walk-in, Greg, correct me if I'm wrong, are 10 to 5. In addition to that, you can vote at the same time. So vax and vote at the Board of Elections. So this morning, we're going to be joined virtually by some of the folks in our community who have gotten vaccinated, and they're going to tell us about their experiences and how it has impacted their lives. So, and I'm super grateful to all three of the individuals that are joining. I'm going to introduce them now. We're going to go to Greg and then go back to them. So Allie Trianfo is going to talk about how easy it was for her to get vaccinated with Hamilton County Public Health and what it has meant to her and her family. Bishop Bobby Hilton had a serious case of COVID back in January. He got vaccinated and has since hosted vaccine events at his church in Forest Park. And Tropicana from Wiz 101.1 is also joining us to share her vaccination story. I also want to anecdotally say that I visited one of the sites a couple days ago. It was up in Sharonville. It was at a manufactured home community, and there were tables set up outside. It was a beautiful day. It wasn't snowing, by the way. It was a beautiful day. And people that lived there who likely would not have gone to get a vaccine otherwise were given vaccines at that site. Health department literally went to where people live to give them vaccine, and there were about 100 folks there, and they're going back, of course, in 3 weeks to make sure they get the second vax and have first vax available again. So it gives you the idea of the availability throughout the community. Also, we've reached out to businesses, we've reached out to housing complexes, we've reached out to nonprofits. Greg is working with schools to make sure, again, that we're out in the community delivering the vaccine, making it as easy as we possibly can. So the bottom line is this: it's easy to get vaccinated in Hamilton County. Every person lives within about 10 minutes of a vaccine site. You can get vaccinated on the weekend, during the week, in the morning, in the evening, with an appointment, without an appointment. It takes very little time, and you will be protecting yourself, protecting your family, and helping this community beat the pandemic. So with that, I'm going to turn it over to Greg, and then we will get to our special guests.
Thanks, Commissioner, and good morning, everyone. I continue to be excited with the progress that we are making with our vaccination campaign. Over 320,000 Hamilton County residents have been vaccinated. That's a wonderful start, and we're excited to see this effort continue. Similar to usual, I'd like to run through the numbers and kind of give some updates that way. Our last peak remains on December 10th, when we had an all-time high of 716 cases per day of COVID. We continue for the last month and a half to hover right around 100 cases per day on average. That's a 7-day average. And we continue to be hopeful that the vaccination campaign, as well as our continued efforts for social distancing and wearing our masks and keeping sick at home, will help to improve these numbers even more. I continue to remind our community that there still are 3,200 active cases of COVID-19 within our community. This large number means there's still a lot of opportunity to get sick, so please continue to be cautious. On this slide, I also provide an update with those variants that we are aware of thus far. There are 7 UK variants, 1 South African variant, and 1 Californian variant. We know that there are probably more variants that we are not aware of here in Hamilton County. We are seeing these statewide, and the likelihood that there are more variants is very high. The good news is everything we know about them is that the vaccine works in combating the variants. So it's super important to get vaccinated soon so that we can continue to build immunity within our community. Very closely tied to our case numbers is our reproductive value. This number has now been hovering around 1 for about a month and a half as well. Today, our reproductive number is 1.0, and for the region, we are at 0.97. We are also continuing to see fairly stable numbers within our region's hospitals. Our 14-county region has 168 patients admitted. In addition, in the intensive care unit, there are 53 patients, of which 38 are on ventilators. So this is a really important number. We are tracking these numbers because we know that a large part of our efforts throughout the pandemic has been to save lives, and continuing to see these numbers remain flat and much lower than where they were is extremely important. Now shifting over to vaccine, as a community, as mentioned, we have vaccinated 39% of Hamilton County residents, which translates to 320,000 residents. There are many, many providers in Hamilton County now with vaccine, and appointments are so easy to make. Early, maybe a month ago, when I talked about vaccine, I would talk about the need to go to every website and try many different strategies so that you would have an opportunity to get vaccinated. Today, almost every website for a provider has available appointments, which is a great opportunity now to get vaccinated. I've heard many folks say that they were waiting. They wanted to make sure the most vulnerable in our society were able to get vaccinated first. Well, now's your chance to get vaccinated if you've been waiting, and there's no line, and it's easy and convenient. As Commissioner Driehaus said, our team has really been working to get creative. We've been working to get vaccine out to our communities, and we've been trying to make sure that our vaccine is accessible to everyone in Hamilton County. This week, as Commissioner Driehaus mentioned, we set up at a manufactured home park, and we're able to vaccinate residents where they live. We're going to set up at the Woodlawn Community Center for the next 6 weeks, taking walk-in appointments right in Woodlawn. I think that's every Monday for the next 6 weeks. More information is on our website. We're also in Delhi, Evendale, Terrace Park, Forest Park, Sharonville, Green Township, North College Hill, and Miami Township. So I think the point I'm trying to make is we are trying to get public health all over our community and get vaccine to you. Every home in Hamilton County is within a 10-minute drive to a vaccine location, and probably every one of those locations has appointments available. So super easy right now to get vaccinated. And I think that's really all I wanted to update on. If you are in the 16 and 17-year-old age, we do require that you get the Pfizer vaccine. That's the only vaccine available. Our team, in working with Children's Hospital, are setting up school-based clinics. I think we have 12 over the next several weeks. And I know Children's is working with many other schools, just continuing to make sure that we can get vaccine to the community where it's needed. As a community, we continue to work towards our goal of vaccinating 80% of our population, and I'm very confident we will get there if everyone works together. Thank you.
Thanks, Greg. And as Greg, it exemplifies, this is a partnership in this community. It's the city, it's the county, it's the hospitals, it's the pharmacies, it's the grocery stores, it's FQACs. We're all working together to make sure these vaccines are as accessible as possible to everybody throughout Hamilton County. So let's get to the fun part of our program today. No offense to Greg. We're going to hear some stories. I know, right? We're going to hear some stories about people that have gotten vaccinated, what the experience was, and what it meant to get that vaccine. So Ali Trianfo is with us this morning. Ali is, you'll see, she's a young person that lives in our community that wanted to share her story.
Hi there. Thank you, Commissioner Driehaus, and everyone at Hamilton County for having this on and for bringing people together about the vaccine. Like Denise said, I'm a young person. I'm 26 years old. I'm relatively healthy. And so what was the rush to get in line to get a vaccine? But for me and for my family, getting the vaccine meant that I got to see my parents, both of whom are immunocompromised right now, and having that heaviness, off my chest, off my parents' chest, and my siblings' chest, to be able to be with my family again, to be able to care for my parents and work together as a family. I mean, that has just made this year all worth it. Staying home, being able to get this little card here, and to be with my parents, especially as we work through different health things, and having the vaccine means that there's one less obstacle that we have to face as a family in making sure that everyone stays healthy. And as a kudos to Hamilton County Public Health, that's who I was vaccinated by. I raced my siblings who could get the vaccine the fastest, me in Hamilton County or them in Franklin County, and we've lapped them. So thank you to Greg and to everyone at Hamilton County Public Health for making it easy, for making it fast, painless, and I really encourage everyone to get in line. It's time, so get out there and get vaccinated.
Thank you, Ali. I love that we lapped Franklin County. I'm going to pass that along to my fellow commissioners in Franklin County. All right, but Bishop Bobby Hilton is here with us this morning. Bobby has a bit of a harrowing story, actually, about his COVID-19 journey, so I'm going to turn it over to Bishop Hilton.
Thank you, Commissioner Driehaus. Thank you very much, and thank you, Commissioner Kesterman, for the work you and your staff continue to do. And may I first say on behalf of Madam President Stephanie Summerall Dumas, we pray for the strength and healing of the family of George Floyd and all the families dealing with similar tragedies. The verdict is in, but the work is far from over. And as we exhale, may we unite in the pursuit of equality, peace, liberty, and justice for all. Now, I'm here to address vaccine hesitancy, and I must be very transparent and honest. When I first heard about a vaccine coming, I was like, I don't know about this. I'm not sure I'm going to allow them to put anything in my body. And, but I listened. I wanted to listen to the data. And as I began to hear about the progression of the vaccine and that it was slowing the spread of the virus, I said, okay, I'll eventually get it. I will eventually get it. Unfortunately, the very last week of December, both my wife and I we tested positive for COVID-19. And this virus affects people in very, very different ways. That was the last week of December. By the first week of January, I was in the hospital in very serious condition. And while in the hospital, things went from bad to worse for me. I ended up being diagnosed with acute hypoxemic respiratory failure. Over 30% of individuals diagnosed with this while in the hospital do not leave the hospital alive. I am very grateful and thankful to God that He raised me up and lifted me up to return home. When I left the hospital, I had to be on oxygen, and to this day, I must maintain and keep oxygen not far from me because I still experience sudden drops in my oxygen level. And physicians have told me that I could deal with this from 6 months to a year, but things should correct. Now, from someone that had the hesitancy, like some of you, to someone that said, okay, I'll do it, but it was a bit late, to someone that suffered with this virus, let me tell you something. I encourage you, study, pray, get the vaccine. It is much, much better to be vaccinated than to take a chance suffering with what still remains a very deadly virus. And if I can do anything to encourage anybody to not take that chance, I would do it. You know, I was hesitant, I got sick, I'm vaccinated, and I'm proud I am, and I encourage you to do the same. Thank you.
Thank you, Bishop Hilton, and we're glad to see you're doing so well. I saw you in person yesterday, and you're obviously doing much better. I'm glad of it.
Yes.
So lastly, we've got Tropicana from 101.1 The Wiz to tell us about her journey with the COVID-19 vaccine.
Good morning, Commissioner. Thank you for having me. I just wanted to share my experience with getting vaccinated. I've been working with Closing the Health Gap, and I've learned so much over the past year of how important it is for us to get vaccinated. And I really wanted to make sure that I utilize my platform, talking to people every day, to let them know how important it is that we were vaccinated, that we work together as a community to be accountable for each other and taking care of others. So I signed up to go get my vaccine, and it was so easy. One of the biggest things that I keep hearing people say is that it's hard to get access to the vaccine, and that is absolutely untrue. Thank you guys to the great work that you guys are doing here in the city to make them easy and accessible. I had my vaccination experience at UC Health. It was a drive-up experience. It literally took less than 30 minutes. It was so easy and so well organized and so efficient that I just want to encourage people that if you feel like you don't have enough time in a day to get it done, it takes less than 30 minutes. I got up at 8 o'clock, drove down to UC, got in line. The line went really quickly. And it's also very hospitable. They have Wi-Fi. If you're anything like me, we stay on our phone and we're always on social media, and you can't get into a garage without Wi-Fi and be on social media. So they have the Wi-Fi set up for you when you first walked there, when you first pulled up, and they had a security guard outside to direct you and answer any questions. And even more so, what I just thought was amazing is that they have a radio station set up where they're giving you all the information that you need as you're driving through. So you're getting the information from the doctors. If you have any questions, they're being answered over that radio. And it just was awesome. Came right in. I had already been pre-registered. I drove right up, got my shot. The nurse who gave me my shot explained some things to me. They sent me to the next booth, literally maybe 5 minutes later, if that. And I had my next date for my vaccination. I waited 5 minutes and I was on with the rest of my day. So I just want to encourage you that if you feel like it's just going to be an inconvenience to your schedule or to your time, it literally took 20 minutes, and in that 20 minutes, you could dedicate that to being accountable for your family, your friends, Allie's mom and dad who were immunocompromised, my son who has congenital heart disease. You could take that 20 minutes of your day and you could save a life by just going to get your vaccine. So I just wanted to make sure that I encourage people and let them know how easy it is. And thank you so much, Commissioner, for all of the work you guys are doing to save our lives and keep us healthy. We appreciate you.
Yeah, thank you. It's as you know, a team effort. So there we go. So, and I want to just highlight one thing Tropicana said there at the end. A couple weeks ago, it was hard to get a vaccine. I mean, you had to go to a number of different sites. There were a lot of people trying to get vaccines. That is no longer the case. Things have opened up. We've got a lot of availability. A lot of people have gotten the vaccine. So I got vaccinated. I've had my second shot. And so a lot of folks have moved their way through the line, especially older folks. As we became eligible, we jumped on the chance to get the vaccine. And so that now there's this great availability from all fronts. at all times of day, every day, to get a vaccine. So please, we're pleading with people. And these three guests today, thank you so much for sharing your stories. They're unique and they're powerful. And so thank you so much for helping us encourage people to go get the shot. Go get the shot. Take your shot to get the shot. All right, we're going to go to questions.
Thank you. Ann Saker is up first with the inquiry. She has questions for you, Greg.
Hi there. Greetings from snowy Silverton. First of all, before I speak with you, Commissioner Kesterman, it's nice to see you, Bishop Hilton, and I'm glad that you've recovered from your experience. Were you in the ICU through your hospitalization?
I was in ICU step down. ICU was full, and they had me in ICU step down. Yes.
Were you on a ventilator?
Thankfully, I was not on a vent, but I was on consistent oxygen while in there. Yes,
Okay.
6 and 7 liters of oxygen.
And when did you get vaccinated?
I got vaccinated probably about 2 months ago. My first shot, and I've had my second shot, so I'm fully vaccinated now.
Okay. All right. Thank you well, it's good to see you. So I'm glad you're recovering from that. I want to talk to you about that further. But
Thank you
now,
very much.
I want to talk about that. So, Greg, it's good to see you. So, here's what I want to ask you. First of all, the county's now 39% vaccinated. There's this regional goal of getting to 80% by the 4th of July, which is 2.5 months and change. Where do you think we are in terms of hitting that particular goal?
So what I know is right now, more folks are getting vaccinated. I think it's going to get harder. Pushing that vaccine is how we pandemic. I think the one other item that I want to just make sure is clear, the number that I shared today, the 39%, is of the total population. And I believe when you see the Health Collaborative's thermometer that shows percent population, it's of eligible recipients. So they remove individuals that are under the age of 15. So the percent I shared today, I think was 39%, and I think the thermometer shows that we're at 45%.
Okay.
So a little bit, I wanted to make sure to point that out.
I see that. Thank you very much for that clarification. That's important. Okay. And so now that we've got all these walk-up clinics, do you expect there's going to be, that's the trend now, is to get people to take advantage of the walk-in clinics rather than emphasizing the appointments?
You know, it's interesting. I think every individual is kind of unique. And, you know, me personally, I would like the clinic time. I'd like to know where and when I'm getting my vaccine, and I'd like to have it scheduled in that fashion. And I think there's still a ton of folks that have that same mentality. But I think there are other folks that want to have the convenience of not scheduling. At our first walk-in clinic site, which happened on Thursday, I was out talking with some of the folks that got vaccinated, and it was really a variety of individuals. There was one woman that said to me that she didn't want to make an appointment and just wanted the convenience of walking up. Another individual indicated that they had multiple jobs and the ability to schedule an appointment was just difficult. And I spoke with an individual that was homeless as well that was taking advantage of our clinic. I think we just need to make sure that we are making every opportunity to make vaccine available for folks where they're at in life.
Okay. That's a very interesting way to approach it. And one other thing I wanted to ask you about, Greg, is about complaints about mask compliance. What are your folks hearing at this point about how well where are we holding on that? Are we maybe letting up on mask compliance? What are you guys hearing?
As far as complaints, I don't have a hard number. I do review our web complaints daily, which is a small piece of the total complaints our office gets on a daily basis, and I'm seeing very few complaints at this point associated with business activity. When I go out to a grocery store or even a hardware store today, I see pretty good compliance. Nearly everyone is wearing their mask, and they're still wearing it correctly. There are a few folks that don't have masks or have the nose hanging out, which is clearly not the right way to do things. But overall, I think folks are still trying really hard in our community.
Have you actually corrected people about mask usage, Greg, when you've been out and about?
When I'm off work, I try really hard not to reel myself back in, but I have occasionally filed a complaint on a business or two throughout the pandemic.
Right. All right. Thank you very much.
Yep.
Thank you. Next up, we have Chris Wederick with the Business Courier, and he has questions for you, Greg.
Good morning, Chris.
Hey, Greg. Good morning. Can you tell me how many vaccine doses we're getting this week? You usually broke that down, although I missed last week. Just wondering how many we're getting this week.
I believe Hamilton County is getting between 40 and 45,000 doses of Pfizer and Moderna vaccine, and that includes vaccines coming straight from the state of Ohio as well as federal allocations. That number is getting a little more difficult for me to track in that I know the federal government has opened up more and more pharmacies that they're providing direct shipment of vaccine to, and so I'm not seeing that complete picture. So I would actually use that 40 to 45,000 as being the minimum coming to Hamilton County.
Okay. I was going to ask, with the expansion of no appointment clinics, were you seeing more doses, or what gives the county the ability to do that at this stage of the game?
So really about 10 days ago, our clinics were filling very consistently without any issue. And about 10 days ago on a Friday, our first clinic didn't fill up. And so we decided that was the perfect opportunity to make that shift. And so when we made that shift, there's always risks. I don't want there to be long lines. I don't want people to get upset about being in long lines. And we want to make it convenient. And I was really nervous about it. I got my team together. My team actually talked me into making the shift. And as a result, we had a few extra nurses on hand. We made sure we had more doses of vaccine than we anticipated using. And what we found out was we had a nice mix of people who had scheduled an appointment and people who came in off the street just for that walk-in appointment. Yesterday at the Board of Elections, we had about 300 and some folks scheduled for an appointment, and we saw another 150 just walk in and take vaccine. And it was really just a perfect complement for folks to get vaccinated.
Thank you very much. I appreciate it.
Thanks. Next up, we have Alexa Helwig with Local 12. She has questions for you, Greg.
Good morning.
Good morning, Greg. As schools are starting to prepare for next school year, I am starting to hear that some might not offer a virtual option, so only going 5 days a week in person. Are you working with any schools or offering guidance or having discussions with Hamilton County schools about removing the virtual option or keeping it? What are you hearing, or what are you guys talking about?
We have not had any discussions directly with schools about their virtual options, but throughout the pandemic, my team, and really quite frankly, all of the public health teams here in Hamilton County, have been available to work directly with schools on their plans so that they can safely operate. We've done, by law, we actually do 2 inspections a year of each of our schools. And so while we're there, the schools are taking that opportunity to consult with us. In addition, many schools have reached out directly with specific plans, whether it's about how they're going to do graduation or if they wanted to do prom in a unique way this year. Our goal is to continuously provide feedback so that they can open up and stay open safely.
You plan to have that discussion about virtual, or do you think it's kind of just will depend on what the school plans to do?
We have always followed the state of Ohio's guidance, which from Governor DeWine, from day one, he has made this all about the schools making a local decision for that school district. And we will continue to support our school districts to make sure they have the best public health information available.
Great. One other question. Speaking of Governor DeWine, he asked high schools a couple of weeks ago to start partnering with local health departments or hospitals to begin getting students vaccinated. Is there anything in the works, or have any schools reached out to the health department?
Yes, we have several exciting things happening here in Hamilton County. Our agency, it looks like, is partnering with about 12 schools. We also have a couple fire departments that are working directly with school districts within their jurisdiction. And Cincinnati Children's Hospital is working to figure out which additional schools might want clinics and is working to set things up as well.
Is there a timeline or when you will announce anything?
We actually have clinics starting this week, I believe. I think each school is kind of unique with what fits in best with their schedule. But yeah, we are starting to work with schools directly now.
Great, thank you.
Absolutely.
Next up, we have Miana Massey with WLWT News 5. She has questions for you, Greg.
Good morning.
Good morning. So I just have one question. It's more along the lines of you kind of touched on these walking clinics and how 10 days ago you guys weren't able to do that was the first one that didn't fill up. Now my question is, are you guys getting more supply? Is that why you're now able to do it? Or do you think maybe these younger eligibility groups don't necessarily want the vaccine as much as the older populations did? What is kind of attributing to these now being, it's just been a switch in about 2 weeks?
I believe there's a mix. We are seeing more supply here in our county. We are seeing more providers with vaccine in our county. And we are seeing those folks that were willing to wait in line having already gotten their vaccination. So those are all positive things. I believe there are a lot of folks that want the vaccine, but didn't want to take that opportunity away from somebody maybe who needed it, maybe like some of the stories we heard, had significant illness with COVID-19 or have parents who are immunocompromised. But now is that chance where folks can get vaccinated and they're not taking doses away from anyone else.
And I also saw some other states that are actually going to high schools and vaccinating those younger people that are eligible. Are you guys in the works of talking to CPS or anything like that about possibly vaccinating their seniors, juniors?
So the way Hamilton County is set up, there's 4 health departments in Hamilton County. Cincinnati Public Schools falls under the jurisdiction of the Cincinnati Health Department. And I'm not certain what plans are in place for CPS exactly. But for our jurisdictions, the areas outside of Cincinnati, Norwood, and Springdale, we are going to go to schools. We're using other partners to go to schools. We're using fire departments to get in. We're using a variety of strategies to make sure that anyone who wants a vaccine can have it. The state of Ohio requires that a parental permission slip be signed, meaning I can't go in and vaccinate a student without parental consent. And as we know, the only vaccine available for school-age children is the Pfizer vaccine.
Okay, and how far out do you think that is before you guys start actually going into the school buildings?
Yeah, I know our first clinic that I'm aware of is Friday. There might have been other ones that I'm not aware of, but we are working.
Okay, thank you.
Next up, we have John London from WLWT News 5.
Morning, John.
And hi, Greg. And our Todd Dykes of News 5 wanted to know how much has the vaccine rate climbed in the past week or 2 weeks here in Hamilton County?
We're seeing about 2% each week over the last few weeks in vaccine acceptance, or I should say first doses administered. And what's exciting to me is when you look at those individuals that are over the age of 65, we are continuing to see those individuals get vaccinated as well. So even though it's open up to anyone 16 and older, we are seeing folks throughout the whole age group get vaccinated.
I wonder about the percentage of seniors, those who are 65, 70, and 80, and why it is sort of at a standstill. I think it's been holding, has it not, at like 70%?
It's actually each week been tracking up about 1% or 2 for those individuals over the age of 65. A couple of those age groups are actually closer to 80% now, which is extremely exciting. And I've said this several times over the course of the pandemic, but with vaccine getting to the older population who's been most impacted by COVID-19, we know that we are making an impact on our hospitalization numbers and severe illness from COVID. So really exciting to see those folks continue to get vaccinated.
Couple more quick questions for you, then I have one for Denise as well. But with the vaccine easier to get and demand falling, are there leftover doses once the clinics are done for the day? Are there doses that don't get used, and do those get discarded?
It is getting harder and harder at the end of each day to find arms to get those doses into individuals. My team has continued to get extremely creative. One day this week, we are going door to door. We've gone to restaurants that are open and asked folks to come in and get vaccinated. But certainly, as we continue to have more folks in our population vaccinated, it is absolutely getting harder to find arms. And I think at some point, some of those doses at the end of started. The good news is a vial of Pfizer vaccine has 6 doses in it. That vial does not get opened until we have one arm to vaccinate. So at the end of each clinic, the most vaccine that I would have left over is the 5 doses that are left after opening 1 dose. That's the most. Often it's 1 or 2 doses that we're trying to find somebody to be vaccinated.
Discarded yet, though?
We have actually, I believe, discarded 2 doses one day this week. Yes.
And I'm wondering on the high schools too, Greg, will you track, when the high school clinics are going on, will you know the percentage or the number of parental refusals to not allow the 16 and 17-year-olds to get the shot?
We will only see the total number of individuals that get vaccinated. It's possible that just because somebody doesn't get vaccinated during a high school clinic day, that they're getting vaccinated at one of the other clinics with a parent present. So we'll be able to track, just like we are all of the age demographics, we'll be able to track those 16 and 17-year-olds to see vaccine.
I want to ask Denise, but you may have some thoughts on this as well, but for the two of you, with the greater availability, you've both talked about how easy it is now to get a vaccine. I'm wondering about your thoughts about asking the governor to increase capacity for indoor events and dining, because we hear from those people in that industry and those businesses all the time about, hey, you know, everybody's getting vaccinated. Why are we still at 25%?
So the public health message continues to be practice social distancing and remain cautious. We have not yet reached herd immunity. We're working closer towards it, and we have been working with many businesses to try and help them open up safely within the state of Ohio's guidelines. About 2 weeks ago, Ohio has adjusted those Director of Health orders and have absolutely made it easier for businesses to operate and to open things back up. I'll pass it over to Denise.
Yeah, I agree with that. I think the governor is starting to shift as more people get vaccinated, but we have to continue to practice all the things we know prevent the spread of the disease until we do have the herd immunity that we need. Gets to the point that we're trying to emphasize today. It's up to all of us to get a vaccine so that we can get to zero cases, zero hospitalizations, zero deaths, zero closures. This is an economic development message as well as a health message. And so it's really up to all of us to do our part to get vaccinated, to keep ourselves safe, and to keep others safe that we're interacting. Two quick follow-ups. The chart that Greg has a chart about who's getting vaccinated and what the numbers are. Let's bring that next week. I've seen this a number of times. Greg and I get together a lot during the week outside briefings. And so you will be, I think, glad to see that there is, what is the age demographic that's over like 80 or so? Is it 60 to 65? 65 to, yeah. So there are groups that are at 80, which is we need to celebrate. Those in the very upper age groups are also in the 70s, right? So yeah, upper 70s. So let us bring that next week so that you can get a better sense of how we're doing with the different age groups, and then the young people getting vaccinated now, which the numbers obviously are ticking up week after week, but they're ticking up in all age groups week after week. So we'll bring that and make sure you see it. The other thing is that when it comes to distributing vaccine and making it accessible, just a reminder, we are still doing these calls a week or every other week with all of the local jurisdictions throughout the county, asking them, do you have a facility? Do you have a site? Do you have a business owner? Do you have an assisted living facility where we could go in and vaccinate people to make it as easy as possible for folks to get the vaccine? The other call that continues to take place is one with the city and the county, the school systems, both the city and outside the city. United Way's on there, the libraries are on there. I mean, everybody is on this call so that we are making sure that as we need to get the vaccine out into the community, we are utilizing all those partners to help us do that work to get folks vaccinated throughout Hamilton County. So just a reminder of the work that has been going on for a year, but it continues because it's so important as each phase presents itself that we continue to work through partnerships throughout the community. So lastly, thank you, Ali. Thank you, Bishop. Thank you, Tropicana. Thank you so much for being on. You really have helped exemplify the importance of getting the vaccine, and I think kind of brought it home for people. So I'm so grateful that you on. And then Bridget seems to be indicating that we have another question.
We do. Next up is Corey Sharber from WVXU, and he has questions for Greg.
Corey's going to kick me off the mic.
Sorry, I didn't want to, sorry to prolong this any further. I know that Denise briefly mentioned that there are going to be more walk-up locations opening. I know last week we apparently only had the one, which was at the Board of Elections. So how many more are we seeing, and where are those locations? I just wanted that for record.
This week, all of the Board of Election sites from Tuesday through Friday were walk-up sites running from 10 a.m. until 5 p.m. We also operated, I believe, at the Convention Center a day of walk-ups, and then some community sites that were not necessarily advertising, setting up our walk-up sites.
That seems to conclude our questions from reporters. Thanks.
Corey, just a reminder, Test to Protect Cincy with a Y, .com is where you can find all sites that are distributing vaccine. Public health, and this is just, Greg will tell you, Hamilton County Public Health is a fraction of what's happening in the community. I mean, we've got Kroger stores everywhere. Hospitals are starting to set up out in the community. So you are seeing this shift amongst ourselves, public health, but also amongst all the providers to try to get the vaccine out into the community. So again, Corey, you messed up my vibe here, but I'm going to thank everybody one more time for being on, and we will be back. Thank you.